It was Winston Churchill that said, healthy citizens are the greatest assets that any country can have. And what better way to ensure this than to make provision for Nigerians to have access to healthcare services without worry about the cost? Welcome to another episode of Easy Access to Healthcare for All, a program sponsored by the National Health Insurance Scheme to give you information about the scheme, news updates, as well as explain issues around the NHIS. I'm Firdaus Ahmed Wakili, your anchor on the program. Sit back as we unfold the program to you in a moment. The program starts with a highlight of recent news events around the NHIS. Our top story is the visit of the NHIS boss to the EFCC, where ties were renewed towards better health service for Nigerians. These and more stories coming up shortly.
The Executive Secretary of the National Health Insurance Scheme, Professor Nasir Sambu, recently paid a courtesy visit to the Economic and Financial Crimes Commission. The visit is the third since Professor Sambu assumed office in 2019 as the Executive Secretary of the NHIS.
Sometimes the institutional...
Professor Sambu, in his remarks, expressed the importance of updating the EFCC chairman, who is relatively new, of the relationship between the two government organizations.
With the incoming administration, we felt that it is pertinent that we come and update the new management under the able leadership of the executive chairman of the efforts done to us, and to also solicit for close working relationship with the organization, so that together we can meet the presidential mandate of attainment of universal health coverage in Nigeria.
Professor Sambu went on to explain the partnership that has seen to the recovery of some NHIS funds held up in some financial institutions and the subsequent release to the NHIS.
One thing that was very conspicuous, over a period of time, NHIS lost a lot of its funds. And I came and I realized that the National Health Insurance Scheme has approached EFCC to recover some of the funds that has been lost in the process. Of particular reference is the 10.085 billion naira that was lost to the heritage, that was trapped in the Heritage Bank. And secondly, there was another 2 billion naira that was trapped in the ASO savings and loans. So when I came, I paid a courtesy call to the then chairman, to the then executive chairman, and they have made some recovery. They have made some recovery, but they were not sure of whether the amount recovered will be judiciously be utilized by the National Health Insurance Scheme. As such, they were not remitting to us. But when I came, I put all the reform agenda that we are embarking upon. The EFCC started releasing them.
In total, Professor Sambu acknowledged that 5.4 billion naira out of the discovered 12.085 billion NHIS funds has been released to them, from which the NHIS has been able to pursue its digitization program. He appealed for more cooperation between the two agencies for better results. The EFCC chairman, on his part, commended the scheme's effort in trying to attain universal health coverage. He pledged the support of the EFCC for the NHIS in all of its dealings.
So the NHIS is a critical stakeholder that the Commission is always willing to support, always willing to partner with, to see that things move smoothly for the benefit of everybody. Every government staff here, more especially even in the FCC, everybody, one way is aligned to one hospital or the other and has subscribed to the NHIS. So the EFCC has no choice but rather to work with you to make you succeed in order to achieve your mission. We will always see to it that the investigation that we are doing already we'll continue with it. We are happy that it's yielding results, and all the monies or funds that are recovered are put to good use. So we will not relent in our efforts to see that each and every kobo that is being lost is recovered for the benefit of the country.
Garki Hospital played host to Professor Nasir Sambu, Executive Secretary of the NHIS, who paid a visit to the facility for a tour. This was as a result of the positive remarks springing from enrollees and stakeholders about the facility. The Executive Secretary, led by the Chief Medical Director, toured the various facilities at Garki Hospital, often deployed for the treatment of patients, including NHIS enrollees. Earlier on, the Executive Secretary had met with the medical team of the NHIS, where he was briefed on the operations of the hospital.
We received the members of the management of Garki Hospital at the corporate headquarters of the National Health Insurance Scheme, where they came with a complaint about 2 HMO, Hygia and the other one, and Healthcare International. So we had an extensive discussion as to how to resolve the issue, which culminated to the promise that we are coming to this hospital to see what the hospital is doing, because we have been hearing about positive responses about the hospital. So today we are here and we are going to see it ourselves, because it is said that seeing is believing.
Yes, sir.
It's not that we don't believe, but we want to reaffirm what we have heard.
So we undertook some reforms and reorganization, and the 2 main highlights of that was we defined standards, right, and implemented standardized processes regarding our NHIS enrollees. We also, from September 2018, also consolidated all our NHIS operations, because before then it was basically, what's the word I'll say now, dissipated or scattered in different units, with different entities doing different aspects of it. So what we did was consolidate everything into one operational unit. So next slide, please. And basically, so this table just highlights the different units and specific responsibilities regarding our NHIS patients.
The CMD further explained how they leveraged on technology to make accessing healthcare easy for enrollees.
So we've been able to achieve all these improvements because of leveraging on health IT, and also because we have explored innovations in processes. A lot of the time, and sorry, you did say something, that the issues were systemic. And the truth of the matter is that without addressing the systems, we really would not have been able to make progress to the extent that you saw, where we jumped from 16,000 patients in August to 2016 to 33,000 plus as of June 2021.
The program is Easy Access to Healthcare for All, bringing you news and issues around the National Health Insurance Scheme. One challenge that has bedeviled the NHIS is the high turnover of executive secretaries to man the affairs of the scheme. Well, in July 2019, a new ES was appointed. How did the appointment come about? What were the issues on ground when he came in? These, amongst other questions, are answered in our next segment, Issues Around the NHIS. Keep watching.
When the National Health Insurance Scheme kicked off in 2005, federal civil servants could access various levels of care at the hospitals of their choice. For the first time in the history of healthcare, Nigerians who are enrollees of the scheme were entitled to consultation and treatment of common ailments like malaria, typhoid, respiratory tract infections, ulcer, hypertension, and about 90% of ailments that Nigerians are confronted with. Enrollees could also enjoy antenatal and postnatal care, as well as deliveries both normal and assisted without worry about the cost implication. In fact, over 95% of disease conditions that affect Nigerians are covered by the NHIS.
I was enrolled with
Enrollees continue to speak well of how the scheme has helped them take care of their health needs and that of their family.
I usually hear from so many other people that probably they will have to wait or something, so I was skeptical about using the service. But I just went and I was attended to promptly. I was treated and I was not billed in any way. So the NHIS covered all my bills.
I gave birth two of my babies through a cesarean section, of which the NHIS covered.
In spite of the benefits of the scheme, most Nigerians in the informal sector and rural areas were excluded from participation. The NHIS, even after several years of implementation, did not expand beyond employees of the federal government. One factor attributed to the stunted growth of the NHIS is the frequency with which the executive secretaries of the scheme were changed.
No chief executive has spent 8 years. Assuming that the law of NHIS say 5 years, renewable for 5 years. If the past chief executives have spent their period, the first one would have spent 10 years, the second one would have spent 10 years, and the tendency of continuity will be there. But because they come and go, and none of them left when he desired to leave. So that attachment is still there, and that comes are there. So it reached to an extent that you have a health insurance whereby unions are fighting, staff are fighting. Sometimes the security agents will even come and be throwing tear gas. So an organization that has that inherent weakness, you should not expect the financial management within the system to be strengthened. You should not expect the technical operations within the organization to be watertight.
All of these challenges prompted President Muhammadu Buhari to take a decisive action to rescue the scheme.
Mr. President had to intervene in the year 2019 by setting up independent presidential panel that investigated the organization, and they made a far-reaching recommendation. And part of the recommendation was why I brought into the National Health Insurance Scheme to try my best and to see how the organization can be stabilized and put in a very good pedestal for attainment of universal health coverage in line with Sustainable Development Goals agenda and in line with President Muhammadu Buhari next level agenda.
On July 15, 2019, Professor Nasir Muhammad Sambo resumed work as the 12th Executive Secretary of the National Health Insurance Scheme. As the Executive Secretary, Dr. Sambo had 10 presidential action points, which include to carry out detailed human resource audit and address all outstanding HR issues, develop a 10-year strategic plan, review the Enabling Act and status of the NHIS, clear backlog of all NHIS unaudited accounts from 2010 till date, establish financial management systems to bring the NHIS in line with the new policy of government-owned enterprises and other applicable extant financial management policies, amongst other points. What Professor Sambo met on ground only confirmed the challenges confronting the scheme that made it practically impossible to provide all Nigerians health coverage.
You want to cover Nigerians, and Nigerians are up to 200 million people, for example. And what strategy is it in place that you will follow from one step to the other to attain that universal, to attain that coverage? I did not meet anything like that on ground. I met NHIS where stakeholders have completely lost confidence in the ability of NHIS to spearhead attainment of coverage in Nigeria. I met NHIS where people have dearth of information. People want to come to the National Health Insurance Scheme and the information are not available. I made NHIS where organization is not working on any evidence. There is no data, no information. And there has been a lot of debate, there has been a lot of complaint and a lot of information as to how many people have NHIS covered, has NHIS covered. Because of the inability of NHIS to have credible denominators that will form the basis of establishing yardstick for its operation. There's no that kind of thing.
Professor Sambo swung into action, consulting with staff and stakeholders while pursuing a mandate to reposition the scheme using a 3-point rebranding agenda, which is restoring a value system that will transform NHIS into a credible and results-driven organization, engendering transparency and accountability in the entire operations of the scheme, accelerating the drive towards achieving universal health coverage for all Nigerians. What are some of the ways that Professor Sambo approached the problems he saw in the NHIS?
And I took all the management, expanded management, into a retreat. And before I took the management into retreat, I circulated a card to every staff of the agency of the health insurance to tell me 2 problems from his own perspective that he believes that is a problem of NHIS. And he should also give 2 solutions. So we aggregated this and we went into retreat with the management. We isolated all those problems from the dimension of all the staff. And we were able to put it in a software called Monkey Survey software. And we came with 10 key domains that are very critical, that aggregated all those responses from the entire staff, because we wanted to ensure that every staff has say in the process of diagnosing the organizational problem and in the process of bringing solution.
Implementing his strategies has seen the NHIS in the last 2 years since the NHIS came on board achieving a level of efficiency that has seen it break new grounds. Staff and stakeholder confidence is being restored in the NHIS to achieve the growth needed to drive the scheme to the next level.
Sambo is approachable and he listens, and we believe immediately he has restored the NHIS HMO meetings. We do that quarterly. So Sambo is gathering all the stakeholders and listening, and then we are all devising how to reach higher grounds.
Professor Nasir Mohammed led NHIS. Some people might not understand why I'm relatively passionate about this man. It's because some of the dreams of the providers, which we had years ago, when he came on board, we suggested those things to him, and they didn't throw us away. He weighed them and adopted some of them. And one of such that we are looking at is, okay, look, if we say this is how it is with the providers, this is how it is with the enrollees, we now want to say, okay, can we have more providers on ground? What percentage have we covered in terms of our journey to universal health coverage? And with the health insurance under one roof, it is no more the issue of this is what NHIS has covered so far. We are talking of this is what health insurance has covered so far.
Those 2 years have been a remarkable departure from what it has been like in NHIS. We've come through a lot of rancor and strife and internal differences. And right now, as you can tell, the scheme is calm. Beyond that, we're also reforming the organization. You can see lots of changes.
A wonderful time of reforms and changes and stabilizing the scheme. A lot of things have changed, a lot of things have been enhanced, and more importantly, we have direction as to where the scheme ought to be.
Welcome back from that timeout. Easy access to healthcare continues with our stakeholders segment. On this episode, we chatted with Medical Director of Maitama District Hospital, Dr. Igbinovia. He spoke on some of the challenges facing healthcare delivery in Nigeria.
Well, the healthcare has come of age and we're doing fairly well, but be that as it may, there are challenges that are there. And like every other thing, finance plays a big role. And you can see that we import a lot of equipment which we use for the healthcare, and the current dollar exchange rate has not helped matters. You need digital X-rays, you need MRI. These ones are quite expensive. You have to import them into the country. We are not able to make those ones at the moment. And apart from that, the population of Nigeria is growing, which means that which goes ahead to stretch existing infrastructures. And as we build more hospitals, maybe we should build more a little faster to cope with the ever-increasing population of.
Dr. Igbinovia, Chief Medical Director, Maitama District Hospital, describes the introduction of NHIS as a well-thought-out initiative that can assist Nigeria attain universal health coverage.
Now, for us to ever have healthcare coverage for all, there's only one way to ever happen. We need a health insurance scheme. And so the health insurance scheme was well thought out, and it came at the right time. Now, because what we normally have in Nigeria is pay for service as at the point you demand the health. And as you all know, not everybody as at that time can have money to pay for service. And if there was no money, then it became very difficult for that person to access health. And if we are looking at a much nationwide coverage, common sense dictates that there has to be some form of insurance scheme which makes it possible to access health care as at then, and the insurance scheme.
Dr. Igbinovia says Maitama has been participating in the NHIS since the program started, and says time is ripe for the scheme to reach every Nigerian. Having been a stakeholder for quite a while, Dr. Igbinovia has some suggestions that all stakeholders should adopt to make the scheme run better.
We'll start from finance again. We will need more funding for it to go nationwide, to reach every single village in this country. And then the HMOs themselves should try to also expand to accommodate more people. Then as the end user the hospitals who actually deliver the services, they should also make it possible, easy for the HMO. What I mean is that sometimes, because when you see the patient, the bills have to be calculated and sent to the HMOs. Sometimes the HMOs do complain that it takes quite a while before these bills are sent. And then we also want the hospital to send the bills as soon as possible. Now, the end user, which is the patient, they too should understand what the HMO is, because like every other thing in life, there's also tendency to abuse. And this abuse can also come from the users who just feel that, okay, it's government owned. No, it's just free. It's not exactly free, even though you might not be paying. Somebody along the chain of command is paying for it. So because of that, we should respect this and make sure that things are done.
Every stakeholder has a role to play, and just like he said, we must try not to abuse the privileges of the scheme so that it can serve Nigeria and Nigerians better. Coming up next, your questions answered.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: is there a limit to what NHIS pays as medical bills?
There's no limit to what NHIS pays. It depends on the claim that is requested, and once the claim is processed according to NHIS fee-for-service schedule, the HMOs will pay to the healthcare facility. The problem we have sometimes is where healthcare facilities do not, comply with the tariff of NHIS. Then the HMO is at liberty to process the claim and reduce it to the amount that is allowed by NHIS.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
This is where we end this episode of the program. Join me again, same time, same station for another episode that brings you the successes and implementation of the National Health Insurance Scheme. Enjoy the rest of your day.